You everything you need to know about diseases. Okay, so a disease is an abnormal condition. It may be acquired later in life, or you may be born with it. It can be genetic, and it pretty much is a physiological dysfunction in one or more body systems. So, for example, HIV disease is a physiological dysfunction in the immune system. Um, so let's move on to disease classification. How can they be classified? Well, they're classified by a number of ways. They can be classified by specific signs and symptoms that characterize pathology and identifiable etiology. Also, morphologic changes, histologic sections, clinical manifestations, diagnosis, and clinical course can classify diseases. So, for example, histologic section is the study of microscopic structures of tissues. So, when you take a histologic section of a individual with Alzheimer's brain, you may notice that in the hippocampus there are amyloid plaques. Those amyloid plaques are what can classify Alzheimer's and just make you like 100% sure that, oh, this is definitely that disease. All right, so let's move on to etiology. So etiology is the cause of the disease. So for example, skin cancer is caused by environmental factors such as the sun. UV radiation from the sun can cause an abnormal growth of skin cells. All right, so let's move on to pathogenesis. Pathogenesis pretty much um, describes how the disease course, so from beginning to end, pretty much. So, for example, the disease course or pathogenesis of HIV starts when HIV enters the body and infects the immune cells. It begins multiplying throughout the immune system and leads to immune deficiency. All right, so let's go to signs and symptoms. They go hand in hand, but they are different. Symptoms are objective and only seen by the patient. They pretty much include what the patient can feel. So, for example, headaches is only viewed by the patient. No one else can feel that other person's migraine. Okay, so signs are objective. They are what a clinician can measure or observe. So, for example, if you see a red rash on someone's arm, or if you measure their blood pressure, it might be too high or too low. All right, so let's go to syndrome. Syndrome is a collection of signs and symptoms characteristic of a specific disease state. So, for example, AIDS, aka autoimmune deficiency syndrome, is the progressive state of HIV. Um, right, so let's go into diagnosis. Diagnosis pretty much explains what is causing these symptoms and signs. So, for example, you might have a common cold and you've been having it for, you know, 3 months, and you're like, why am I still fighting this cold? What's wrong with my immune system? Well, you go to the doctor, they give you a diagnosis, say you have HIV. Okay, so let's go to complications. Complications are possible unfavorable consequences of a disease. So, for example, in diabetes, a common complication that occurs is nerve damage, right? Let's go into prognosis. Prognosis is defined as the outcome of the disease. It's usually like based on probability. So, for example, let's say that you have lung cancer and it's pretty progressive. It's in a late stage, and the doctor says, okay, your prognosis is that we won't be able to treat it because it's so progressive and you only have 2 years to live. Well, 1 year, okay. All right, so let's go to diagnostic media. So, diagnostic media, what it does is it helps us identify a particular microbe. How it does this is the media has metabolic and growth patterns only specific to that particular microbe. So, for example, Mycobacterium tuberculosis, it can only grow on certain media. So, when we swab someone and then put that bacteria on the plate, that bacteria is selective. So that way we can see, oh, the bacteria is in this class or this class. It's really helpful in helping with the diagnosis. All right, thanks for watching.